I'm Dr. Juuko Derrick. I'm a pharmacist by profession. Because I'm a futi pharmacist. Beba abantu abakola eddagala era ne balitunda. I've been very much privileged okukola mu field ezisinga in the medical profession. Nkozeeko mu ddwaliro ne clinic environment, nkozeeko mu community pharmacy, nkozeeko mu kitunzi. So for most of my time I've had a chance to work in the business environment, the medical field. Currently, era kati nzirukanya ebintu bya business consultancy nga tuyambira ddala zino zi business naddala zi health ventures. Those are the business in the health sector to thrive in this dynamic business environment. Ebintu by'obufumbo, yes, that is something that I'm shaping myself into. And I like seeing people healthy. I like seeing people benefit from the drugs that they're taking. So for most people that know me, especially when they come to me and they're consulting about drugs, tera nnyo okubagoberera ne mbabuuza eddagala ly'otutte oba ly'omize likoledde batya. Abantu ba business, njagala nnyo okulaba nga business ekula. As a young boy, of course, I wanted to do IT. You know, when I tell people that I want to do IT, they joke so much, or they laugh so much about it. But along the way, I kept on changing my priorities. So from being an IT enthusiast, I started liking medicine. That's a medical doctor. But later on, I was told that medical doctors spend a lot of time in school. So I found myself doing pharmacy, which is a course that doesn't take as much time as medicine. But also, I was much privileged that I had the grades, so I found myself doing pharmacy as a course. Yeah, of course, there's a lot of influence in family. My family has very many pharmacists, so that was very easy for me to join pharmacy. But above all, my journey as a pharmacist, when I joined medical school, I fell in love with drugs and molecules and how they are made and how they affect the body. So for me, my daily work is always driven by the passion to understand how drugs are working in the human body. But then also from a business perspective, I basically also carry the same passion to see that when I'm doing my consultancies, the various business projects that I carry on, make sure that they're able to solve their problems and achieve the results that they desire to. Yeah, so that's what I can say to what I do. That's just what pushes me to do what I do. Yes, it's passion and a lot of factors. Thank you. Yes, so many people ask me about the difference between conventional medicine and supplements. Yeah. And let me start with what conventional medicine is in the simplest way as I understand it as a pharmacist. So conventional, as an English word, it means something which is widely accepted. So if you are to go to the genesis of medical practice, of course, there's a time in the history of medical practice where scientists started doing research studies, and then the study of medicine was made standardized in the entire world. So the study of medicine, when it was made standardized in the entire world, then also the practice of medicine, or how medicine was given, was made standard. So every time you see the word conventional medicine, basically means medicine which is widely accepted. And this medicine, one of the characteristics it has is that it's so much research based. So I would say that as a pharmacist, all the drugs which are highly research based, they become conventional medicines. So for most of you, abakozesa antibiotics, these drugs which are prescribed by doctors, most of the drugs which are prescribed by doctors, they fall under what we call conventional medicines. Now, when it comes to supplements, these are just words actually that were given to medicines because of how they are used. Conventional, because it's widely accepted. Yeah? Like people the people who developed a certain way of doing medicine or of treating. Yeah, so they called their medications conventional medicine. Then the supplements, yeah, they were just called supplements, and this one I should say that they just accompany the conventional medicine to treat. So most times what I tell patients is that these are different. Conventional medicine and supplements, yeah, they're just words which are being given to different medicines according to their acceptability, yeah, in this space of medical practice. Yeah, for example, when we talk about supplements, we have dietary supplements. Those ones definitely they come from the food that we eat. We have things like herbal medicine. Yeah, herbal medicine also. In some parts of the world, they're actually referred as supplements. Then also we have other practices like acupuncture, the Chinese traditional medicine, the Ayurveda from India. So in some parts of the world, they are referred as supplements. In some other parts of the world, they can be referred as conventional. So for me, in a nutshell, conventional medicine is that which is widely accepted, and as of now, is that medicine which has gone rigorous research. Supplement medicine is that can be used alongside conventional medicine. Yes, I would say that supplements cure, depending on the supplement that you're using. Supplements can actually cure disease, depending on what you're using. Because like I've said, the words conventional means widely accepted. Supplements means that you can use with conventional. So depending on the diagnosis, yeah, and what the patient is taking and the patient journey, definitely some supplements have actually been found to even provide better, even give better results than the conventional. So for me, in my practice as a pharmacist, the word conventional and supplement, I just see it as words that are being given to support the various medical practices. I would say for my practice that, first of all, the public is confused about supplements, but also us, the medical practitioners, the pharmacists and the doctors, I've seen very few people that actually can confidently use supplements, and I don't blame us, the pharmacists or the doctors, because even in our practice, when they're teaching us, if you look at the curriculum, we don't really go so much into the study of supplements. So if I'm to talk about myself in my practice as a pharmacist, most times when I'm recommending supplements to my clients, the first thing, I first sit down with them and we set health objectives. We try to understand what is that they're lacking in their body, and then we're able to choose the right supplement for them. Yeah, so I would say that the public is not understanding the supplements very well, and it's because the people who are practicing the conventional medicine, the pharmacists, the doctors, who are now very many, are also not really taking time to understand the supplements, but also it's because of the training. So I would say the training is not helping us really understand. Okay, as someone that has widely worked with patients, I've seen supplements that have done wonders, yeah, where conventional medicine, the one that's so-called conventional medicine, has failed. So I think the area of medical supplements, I want to call upon the fellow professionals to take interest in understanding more about the supplements. Probably if it means having an extra course in them, that would be very good. And this will also help us guide society on how to best use and how to best choose the right supplements. Because I've seen very many wonders the supplements are actually doing among the patients if they're carefully selected and carefully used, and also the patients carefully followed up. We need to all understand that where we're living right now, the society that we're living in, especially the food. When I talk about supplements, very mostly I refer to dietary supplements. Indeed, most disease that we get is from what we eat, from what we don't eat. So that means that if you look at the current environment we stay in, most of us really don't have very good feeding habits. That means that the chances of us getting nutritional deficiencies is so much on the rise. So the use of supplements is inevitable, that it's no longer a luxury to have a supplement, because no one, even me myself, I cannot say that I take food, I take the right amount of food in the right quantities with the right nutrients. So for me, I think in this day and age, it's high time we started taking supplementation very seriously, because with that, we are going to curb some diseases. Indeed, there's a lot of research that's available that is showing that most people actually these days are dying, because of these chronic diseases. We call them the non-communicable diseases. And the non-communicable diseases, one of the biggest causes of these non-communicable diseases is, of course, lifestyle. And of course, if you have to go back to lifestyle, look at most of people's lifestyle comes with a lot of nutritional deficiencies. So that one drives back to supplements. So me, I really want to advocate to the public and to the health professionals to start looking at this field very seriously, because as we talk, this talk of supplements is not very common among the doctors, among the pharmacists, and yet it's the reality which we are facing in this current generation. There is quite a lot of things that are going wrong with the food that we are eating, and it's high time that we started. It's high time that we started giving attention and detail to what we are eating, how much are we getting in, and inevitably supplements can now be added to the regimens of our different patients and clients to ensure that their lives are much longer, they are much better. Most times when people ask me about the question of lifestyle, I usually want to refer to our body. Let us look at our body as a machine. I think for those of you that have cars, just look at your body as a car. Imagine when you are born, you're still very young. Your heart is very young. Your liver is very young. Everything about you is young. The older you grow, that means that you're going to start overworking your body organs. If maybe you are moving 1 meter as a child that is crawling, you're going to start moving maybe 10 kilometers by the time maybe you're 3 years. It means that as we grow old, our bodies are also overworking. Indeed, the difference between machines and our bodies is that our bodies have capacity to repair themselves, but also sometimes when they're repairing themselves, they fail to repair themselves. So how do we make our bodies repair themselves? It is through what we eat. It is through how we live. If we don't eat very well, if we don't live very well, our bodies lose the capacity to take care of themselves. Still, let's go back to a car. In case you have a car and you're not servicing it very well, when it gets an accident, you don't paint it. When maybe it gets a dent, you don't take it to the mechanic. Or maybe instead of they tell you to take fuel, maybe they tell you to take petrol, and then you put diesel, definitely the car will run down. So when I talk about lifestyle and wellness, I'm always talking about if we understand our bodies, how we're supposed to take care of our bodies. Now, one thing we need to know that our bodies are just an extension of nature. That means that if we pay attention to nature and study nature, there are chances that our bodies are going to thrive. Now, this comes to nature. Nature is full of plants. And plants, let's say this, I'm talking about food. I'm talking about the plants that have medicinal uses. Nature is full of oxygen. That means that definitely you need to breathe good oxygen. Nature is full of hills, it's full of all these nice things. So lifestyle, most times I talk about lifestyle, I tell people, look at nature, study it, understand it, and then know that you're an extension of nature. What are you eating? Is it from nature? If it's not from nature, most likely, instead of taking petrol, you're putting diesel in your body. Definitely it's going to run down. So there are people who overwork and they don't want to rest. Definitely your body is going to crash. So we have those people that are always eating little food. Before you know it, they have ulcers. So I think the best way to understand lifestyle is looking at how machines work and then compare your body to a machine. But the difference here is that your body is an extension of nature. Where in nature we're talking about water, we're talking about plants, we're we're talking about animals. That's your body. For machines, of course, especially like a car, we're talking about mechanics, we're talking about fuel. Yeah, so if you work for a very long time without resting, look at your car. If you drive it for very many months without parking it, you guys are gonna crash. Yeah, if you're always putting little fuel, the fuel pump will burst. So if you're always eating little food, you're gonna get ulcers. So for me, the simplest way is to understand our bodies and compare them to machines, and then we ask ourselves: Are we really mindful of how we want our bodies to be? Talking about food, I usually want to compare our bodies to machines, because the same thing for our human bodies to work. We need food. Food is like the fuel for our bodies. Yeah? That means that if you're just taking any food, definitely you are doomed. Knowing that our body is an extension of nature, that means that we need to eat things which are like nature, which are nature-like. Yeah? So with the right food, you can avoid a lot of diseases. With the wrong food, you can actually create a lot of diseases for yourself. So for most times, what I tell my patients, especially the ones who are addicted to junk food, I tell them the choice is yours. Yeah, if you really want to have a messed up body, whereby maybe in 10 years' time you have a lot of clogged arteries, you have high blood pressure, you have arthritis, you have this, just look at the food. What are you putting in your body? Because whatever that we eat, our body is going to use it and convert it. If it's dangerous, it will convert into dangerous things which are going to remain in the body, and unfortunately not all of them are eliminated. So if we take in food which is very, very, very useful to our bodies, even when the body retains it, it's going to turn into useful components that are going to sustain life. Yeah, so I would say that making good health choices starts with what we eat and how often we eat. So it's very important to know that anyone who's serious about avoiding disease and having better health, they have to look at what they're eating. So I can just leave this to everyone. Every time you're trying to eat something, ask yourself, does my body need it? At least if you cannot really understand, and maybe you have a machine, any type of machine, as long as you're putting something which is supposed to go there, that machine is going to function. So for us, our bodies, we need food to function. So if you put anything which is not nature-like, well, we've made a choice. But the best choice is to eat something to be nature-like if you really want to live a long life. If you want to live a life when you're not growing old so fast. I'm talking about my friends who like drinking a lot, Yeah, so food is as important, especially when it comes to managing disease. As a pharmacist, using lifestyle and food as treatment, definitely, as far as I can remember, I think I've helped more than 10 patients become better, even withdraw from the conventional medicines. Notably, I've had patients that have presented with peptic ulcer disease, gastritis, I think in my language, beta ulcers. I've had almost over 4 patients where we've talked about lifestyle, and as far as I can talk right now, they're doing much better. They're not on any medication. I've also had a few clients that have had hypertension in the earlier stages, that even had started taking hypertensive medication, and discussing on lifestyle and taking a few supplements. They've actually gone back to their doctors and their blood pressures are well maintained. So mostly in the area of peptic ulcer disease, high blood pressure, and diabetes, that is high blood sugars, I've seen very many good testimonies that have come as a result of lifestyle modification, then also taking in the right food. So I'm very confident that this is another field that can actually prevent many people from suffering with unnecessary disease. As a person, I rarely fall sick. I was actually joking with one of my friends that I've taken 2 years without getting flu. So I'm very, 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 very strict on what enters my body. I'm one person that can go to a fast food shop and I'll just take water. I like eating vegetables a lot. Where I have chance, I do exercise. The fact that I don't have a lot of weight, so sometimes I don't find a reason to do exercise. But I do walk a lot. I take a lot of water. So for me, my formula is I'm very strict on what enters my body. I just don't let anything enter my body. But then also for my other health objectives, I set out. I just take some supplements. For example, there are times where I feel I need to boost my immunity, so I take those supplements that help in that. There are times when I feel my gut health is in need, and I take those supplements. So I take a lot of time without taking medicine. I don't know if maybe it's something that with pharmacists, most of the pharmacists actually don't like taking conventional medicines. Yeah, but for me, I don't like taking conventional medicines. Not that they're bad, but then at the same time, I make sure that my body is an extension of nature, and that can only be achieved through what we eat, the food and the supplements. Now, for those of you that probably may want to reach out to me to understand more about lifestyle wellness and how that can be used in treatment of disease, that is based on my experience, and also those that also trying to start health ventures here and there, business ventures, and they have a lot of questions and answers, you can reach out to me on my email, derrickjuuko17@gmail.com, or my WhatsApp, +256 702 4509 38, and we have that discussion. I do believe that with the right lifestyle and the right food and the right supplements, you can actually live a stress-free life. And please don't forget, minimize stress. I was just talking to one of my colleagues and I was telling them, how do you manage to keep young all these years? And they told me I try to avoid stress. So that could also be medicine, avoid stress. Yes, I would like to thank Testimonies Africa for the platform and opportunity to be hosted here. Indeed, I've had some of my clients use some of the products for Cellular Wellness Africa, especially Celagen and Rider, and indeed they have reported very good results. I'm very much amazed by how Cellular Wellness Africa is taking supplements very seriously. They have quite a number of users, and I think for most of your clients, they'll be able to find solutions as far as their supplements are concerned.